Are there any new emerging diagnostic tests for CLL that may be helpful in the future? What about MRD testing?
We're actually very lucky to have now some good precedent with this very fancy diagnostic prognostic test called MRD testing, or molecular residual disease testing. And there's a few versions of that test. Mostly we use a version called clonoSEQ, which probably has the best precedent. And this is an extremely fancy way of detecting even the tiniest amount of CLL left in the patient's blood after therapy. So the most common way that we use it is we sort of use the test once prior to starting a therapy, and then once maybe at 6 and especially 12 months into the therapy. In fact, we've mostly used it particularly with one therapy called venetoclax, which we usually use in combination with an immune therapy, because venetoclax has been shown to get a good number of patients, the majority of them, to be, we say, MRD negative, molecular residual disease negative. You can't even see the tiniest bit of CLL in their blood. We don't want to confuse that with cure, per se, because there could, even below the threshold of this test, still be something left, and patients might eventually relapse. But patients that become MRD negative by that test have a very good prognosis, and they seem to stay in remission for years. So we're very grateful to have that new test, which has been around for a few years, but really getting implemented, especially over the past couple of years.
One test that is exciting and relatively new is minimal residual disease testing, or MRD testing. So this is a highly specialized test that helps detect small amounts of cancer cells that may remain in the body after treatment or during remission even. This is a highly sensitive test that helps in detecting residual cells that remain after therapy that are not otherwise detected by standard clinical or laboratory tests. So the MRD testing can be valuable in understanding the depth of response to treatments, and also in predicting the chance of relapse or recurrence of disease in the future. It can provide valuable information on the effectiveness of the treatment, and also determining further treatment approaches in patients with CLL. MRD testing in CLL is typically performed using a flow cytometry or by molecular genetic tests such as a polymerase chain reaction, PCR, or next generation sequencing, or NGS. These methods target specific genes or immunophenotypic signatures that are unique to CLL cells. By detecting and quantifying these markers in the blood and bone marrow, MRD testing can help in determining the presence or absence of residual disease. So the results of the MRD tests are reported as the number of residual cells per a given number of normal cells, reported as a ratio or a percentage. So a lower MRD test would indicate better control of disease or a lower chance of relapse, versus a higher MRD test would indicate a higher chance of relapse or recurrence of disease. MRD testing can be very useful in CLL, as this disease is characterized by a good degree of heterogeneity, and patients can have varying responses to treatment. So by providing a more accurate assessment of the treatment response, the MRD testing can help determine the sequence of next therapies, and thus really develop a personalized treatment decision-making for a patient.